Hi everyone. So it's Tuesday and we are going to have um presentation. Hi Brit.
Hi, Lisa.
How are ya?
I'm doing okay. How are you?
I'm good.
Oh, so nice to meet you.
Yeah, so we are about to start today. We have today Brit here in the live video for Whitman-Walker. And to start, just to let the people know, over the past few months, the Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics on HIV and STI sexual health practices and access to care, social determinants and of health and general public health intervention. So the next area of our outreach session, we focus on the current pandemic COVID-19 and ways to manage your sexual, personal, and mental health. So the community health team is here to educate and support you. So thank you for being here today, Britt. I think it was about the time last year that we were talking with you about update to gender affirming services and in particular, how COVID-19 pandemic impacts hospital and upset people surgical goals. Why you bring you back today?
Hey, Lisa. Yeah, thank you for having me back. COVID-19 has absolutely shifted people's access to gender affirming surgery or gender affirming care altogether. So I came back to remind people about Whitman-Walker's surgery navigation program and share a little bit about what sort of the landscape of accessing care with different surgeons has looked like and sort of how the team works.
Sounds great, Britt. So I want to hear more about how work Transgate Navigator. Can you tell us about the surgery navigation process?
Yeah, we have had a surgery navigation program in place for about 6 years at Whitman-Walker, and it really kicked in when DC Medicaid started to include gender affirming surgery in its coverage. So, for nearly 7 years now, people with DC Medicaid have been able to access several different medically necessary procedures as part of a medical transition. And similar with Virginia Medicaid and Maryland Medicaid, there are access to certain surgeries. Unfortunately, it's not as simple as just getting a referral from a doctor and showing up at a surgeon's office or specialist office. So to make it easier for people, we have two full-time trans care navigators, one of whom is bilingual in Spanish.
That's great.
And yeah, they help with patients along the way. So we try to help people to understand like the steps in the process, like why there's a process, think about insurance coverage, hear about some of the surgeons we refer to, and link them to behavioral health support. We help with scheduling consults, and we stay connected with people through their post-op care too.
Oh yeah, that's good. So Transcade navigators do a lot. So it's like it will be difficult to access gender affirming surgery on your own, huh? So like it doesn't sound like very straightforward. So what is that?
Yeah, it's not very straightforward. Thank you for saying that. When we talk with people about the process, we usually describe it as like playing a game. We're all sort of doing the things that we're being asked to do to satisfy these requirements of some systems, so to speak. And we know that these are systems that are founded in white supremacy and for cisgender, heteronormative people. So yeah, we know that those systems are holding a lot of gender norms and binaries. But if somebody wants to use their insurance, if they have insurance, or a lot of people, if they have insurance, they have to use insurance, they can't afford it otherwise, then we sort of have to follow the rules that are in place by their insurance or by the surgeons. Thankfully, there's some predictability. A lot of insurance follows these guidelines by this group called WPATH. It's the World Professional Association for Transgender Health. sort of like a group of clinicians who try to set standards of care. So it could be kind of predictable. Most people, for any surgery above the waist, you need one letter of support from a mental health provider. If a surgery is happening below your waist, you need two different letters from two different mental health providers. So insurance and surgeons can also have their own individual guidelines.
Wow, that's a lot. What else does WPATH have to say?
Well, WPATH is just one set of guidelines out there but we know that a lot of people kind of, or groups, follow those guidelines. WPATH recommends, for example, that if you're 18 or up and you're trying to access gender affirming hormones, you should be able to do so via informed consent, which means you shouldn't have to talk to a mental health provider or like try to prove that you're trans and need hormones. So we at Whitman-Walker, we follow informed consent, and we're really happy to be able to do that for people ages 18 and up. WPATH also makes suggestions like that people be on hormones for 12 months before accessing a lower body surgery, and other recommendations like that. These are just guidelines, but we see a lot of people in groups interpreting these guidelines as if they are, really strict rules. Again, that's because usually that's how you're playing this game with your insurance.
Okay, so Britt, how does this work at Whitman-Walker? What is our process supporting people?
Well, like most things, I think we try to work as a team. So a person's going to start off discussing their surgical goals in a medical visit. We know that some surgeons do have some like kind of wild physical body requirements. So we have medical providers start off those conversations with patients to sort of help prepare them for what a surgeon might require, talking about things like a body mass index or needing to have hair removal for certain procedures. Some surgeons are really strict about nicotine or tobacco products. So the medical providers start off there. Once that conversations happen, a medical provider would refer someone to a trans care navigator. The navigator's going to have kind of a conversation like this, sort of orient people to the way that we're going to support them, answer any questions right off the bat, help to schedule them with a mental health provider if they're not already working with someone. Those behavioral health folks are doing assessments specifically for gender affirming surgery. So it could be 2 to 5 sessions depending on the surgery someone's having, and maybe spend a total of 3 to 6 months going through the medical visits, going through the TCN process, going through behavioral health support. At the end of it, someone's going to have the letters of support that their insurance requires. They're going to know about surgeons that we commonly refer to, and they should have some idea of what their insurance will cover.
Great. So let's see, we have one question here. So does WPATH are translated?
Yeah, thank you for that question, Alexa. I
Alexa.
think, right, so WPATH, is it led by trans people? I don't know the exact percentage, but historically, no, it's been a lot of cisgender or non-trans people contributing their opinions or experiences to shaping these guidelines. My understanding is that over time, there's been a really big push because of advocacy within the trans community to have more direct representation from trans folks. So people who are actually themselves maybe going through surgery processes or experiencing these guidelines, they get to chime in and help shape what those look like.
Thank you, Britt. So, Britt, if someone has outside primary care provider or even maybe getting hormones somewhere else, can they work with Whitman-Walker for letter and navigation too?
Absolutely. Yeah, we work with anyone with the caveat that they do have to attend a couple of medical visits. Again, because of those conversations that we want medical providers to have, just checking someone's overall physical health. We might even ask for records from an outside provider. So you attend a couple of medical visits, you get some blood work drawn with us, and then you'll get linked to a navigator and can access behavioral support that way.
Thank you. So how does your team know which surgeons are out there? Do you make professional recommendation?
Oh, great question. Right. How do you find surgeons? We get this question all the time. So for the last 7 years that DC Medicaid has been covering surgery, it's been a lot of like guessing and moving targets. We spend time reaching out to hospitals in the area that accept Medicaid, and we say, who are your specialists? Who knows how to do these procedures? What training do they have? We work with gynecologists, plastic surgeons, urology, ear, nose, and throat surgeons, and probably just go with who they recommend. And then we sort of try to get people's experience and hear what those different surgeons are like. For a couple of years, for example, for several years, up until 2018, there had never been a surgeon accepting DC Medicaid who performed vaginoplasty. And then there was one, and he accepted DC Medicaid for just a couple of years, maybe a year and a half, and then he dropped Medicaid. So there's a lot of back and forth trying to stay up to date with what's happening. We hear about surgeons all the time though, and usually a hospital will contact us and say like, here's your one surgeon in the area who's gonna be your go-to, the one person who will do trans care. Sometimes that's what it's like too.
Great. So, great. So do you all get to make recommendation? I'm sure you have a lot of experience in hearing from patients who provide the best care.
Yeah, we do hold a lot of experience. We've referred like thousands of people for gender affirming care. We hear a lot of stories about what people have experienced in different surgeons' offices. And we can't like vouch for any one surgeon in particular as Whitman-Walker. So we really try to talk with people, encourage them to do research, either like in their own community. Do they know anyone else who's seen this surgeon? Can they read reviews online? Can we point them towards reviews, maybe in a Facebook group? And we also encourage attend as many consults as you are able to. We know that resources and someone's access to resources can be a limiting factor in going to consults. So some people can travel hours away or to the opposite coast to access a consultation, or some people can wait 2 years on a waiting list, and we know not everybody can do that. So the navigators, we try to talk with people about all of the things to consider and help folks to make decisions based on what they need.
That's great. So I hear why you saying at Whitman-Walker is not our role to play to tell someone who have a surgery with, but not to empower people to make the best choice for them. So that's pretty great. I love hearing about the Trans Care Navigators program today. If someone has a question for your team through the process, what is the best way to be in touch with the Trans Navigator
Yeah.
team?
Well, I'm going to share some contact information after. I saw we got a question of, is it okay if I answer this question
Yeah,
from
of course. Yeah, yeah.
Okay. It says, what if a person's health insurance isn't set up properly? This happens sometimes where we hear that people maybe, there's a lot of ways insurance can be confusing. It can be really hard to know what your specific benefits are. Also, we've recently experienced that some surgeons have told us, oh, we take this insurance, and then we find out after the fact it's very rare that there was a credentialing issue. And recently there was a surgeon's office that they didn't have their paperwork all set up. If you're having issues with your insurance, we want to help connect you to our public benefits team or your navigator to try to help understand what happened with your insurance in that surgeon's office. Sometimes it can take us a while to know what happened because the surgeon's offices don't always know that there was a problem, just like that example I described. If you're working with Whitman-Walker and you were connected to a navigator, that person will try to help make sense of, be that middle person, hear that communication from surgeons, and help you get the answers you need. So Lissa, I think your original question was, how does someone get connected to the team?
Yeah.
And yeah, my phone number, I'm going to share it here, is 202-797-4457. People are welcome to reach out to me, whether or not you're a Whitman-Walker patient. And then my team, there are 3 of us, we all do this work, and we can be reached at the word trans health, all one word, transhealth at Whitman-Walker.org. And each of us responds to emails Monday through Friday. And I think you can find us back. I think we'll be back later this month talking about more gender affirming care issues.
And thank you again, Brit. This is a great information for people who are looking for surgeries and gender affirming services care is the best way. And the Whitman-Walker has the best team to help people out there. So before we go, we want to give you a few reminders about the COVID-19 and the vaccines. If you already got vaccinated, congratulations. You have been taking a really important step to prevent yourself, your loved ones, and your community from illness. So the Delta variant is soaring across the United States at the moment, and it's totally understandable why you may want to keep wearing your mask. So the vaccine is not 100% effective, so more contagious variants are spreading out there, and there are very few protocols in place to actually verify that folks around you are vaccinated. So keep on and stay alert.
Yes, exactly. And if you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone ages 16 and up are eligible to receive the vaccine, period. So please reach out to us at 202-207-2480 to make an appointment for the vaccine. And if you're having trouble making an appointment with us, for DC residents, you can find information on COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 855-363-0333. And you can track the speed of COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't wait.
Great. So also for Maryland's residents, learn more about the Maryland vaccine distribution process and the schedule and vaccination appointment at covilink.maryland.gov or by calling 855-634-6829. If you live in Prince George County, visit their vaccination registration portal here. And you live in Montgomery County, visit the vaccination registration portal here. And or call 240-777 or 311 to schedule an appointment. Also for Virginia residents, learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 867-829-4682.
And if you haven't been vaccinated and you're not looking for an appointment, we ask you to continue following CDC guidelines for mask wearing, quarantining, and social distancing. We do think it's very important that you get the vaccine, that you're discussing COVID precautionary measures with those around you, being mindful of masks or keeping your distance, especially when you don't know whether a person's vaccinated or not.
And if you want to support Whitman-Walker, register to walk Run Through the Night this year, virtual walk and 5K and end HIV on Saturday. So it's going to be on October 23rd. This year mark a special year. So it's the 35th anniversary of walk. And to register yourself or to team, you just have to go through walk2ndhiv.org. And also remember to follow us in Instagram, Facebook, and Twitter, and checking our website at www.whitman-walker.org. And for most update information on our services and for more community resources in general, Whitman-Walker services, please call us at 202-797-4439 for HIV and STI testing appointment only. Remember, 202-797-4439. And also follow some more programs at www.family at Real Talk DC. That is a slash.
Yeah.
And also at Not Filter DC and also at the Corner DC. Thank you, Britt, again for being with us today. And I hope to see you soon. So thank you again. And I hope people are enjoying this program with us. And if you or someone out there have any question, there is great information. You can just call us. And thank you so much. I see you next time.
Bye.
Thank you, Brie. Bye bye.